Good afternoon, Senator Nelson.
Good afternoon. Please have a seat.
Thank you. My name is Jacqueline Washington, and I appreciate you taking the time to meet with me today to discuss doing away with the deadline for Senate Bill 293 in reference to home telemonitoring. As you are aware, Senate Bill 293 will reimburse for home telemonitoring services until September the 1st, 2015. After that, Medicaid will not provide funds for home telemonitoring services to patients. I know that you're an avid supporter of health bills and have been successful in having Senate Bill 7, the Medicaid Efficiency Bill, approved.
How will eliminating the deadline of Senate Bill 293 be beneficial when we will actually be spending funds to continue providing service?
I'm glad you asked that question.
Mhm.
Home health telemonitoring services have been proven to cut back on emergency room visits, especially by Medicaid patients using this service. Home telemonitoring allows for early intervention whenever a problem is noted in patients' vital signs or symptoms. Patients have the opportunity to call their home health services if they're expecting health problems and have contact with nurses who assess the patient's condition and make the determination whether to call the patient doctors for further instructions or orders, provide nursing intervention, or in the case of a true emergency, alert EMS. Home health telemonitoring also cuts down on readmission to the hospital after a patient has been discharged, which is further savings for the Medicaid system. Home telemonitoring provides a sense of security to our elderly patients who usually have a comorbidity of illnesses, knowing that they have someone to contact at the onset of their symptoms who will assess their health condition instead of waiting until the last minute when their symptoms worsen and they have to go to the emergency room is a security blanket for these patients. I know here in the state of Texas, many of our patients wait until the last minute to call EMS because they're afraid that if they call EMS and they're not admitted to the hospital, they will have to pay for the emergency medical services, which the majority of them cannot afford. So what happens in the end is that we as taxpayers end up paying for these services. Another advantage to using a home telemonitoring system is providing services to patients in rural areas. Most of these patients do not even have a hospital readily available to them, and they rely heavily on the home telemonitoring services to provide services, health services to them. Research has indicated that these services have actually reduced the number of acute care hospitalizations for patients living in the rural areas. Again, I thank you for meeting with me to discuss this initiative, which is very near and dear to me in providing the best and most cost-effective care to our patients. I will leave this brief with you with more information about this initiative along with references and my contact information, and I look forward to your support on this initiative. Thank you.
Thank you. Make it work.
312, you can cut off.
Oh, good. Well, you still got to add your little
Oh
thing.
shit, it didn't stop.